Today I am popping on just for a minute to discuss a topic that some of you may or may not be familiar with, and that is the condition or the term dyspareunia. If you haven't heard of it, you'll see it in the description of this post. So first of all, I want to discuss what dyspareunia is. And simply stated, it is a medical term used to describe recurring pain in the genital area and within the pelvis during sexual activity or penetration. Okay, so obviously this can be super distressing, both physically and emotionally for a lot of individuals, but also for individuals that have partners. And it's something that I see a lot with clients. I'm sure there are some of you within this group too that struggle with dyspareunia. So that's why I think it's really important to discuss this topic. Dyspareunia can typically be divided into two types. So the first is superficial dyspareunia, and superficial dyspareunia is pain that's felt more at the entry of the vagina, or just right around the labia, the lips of the vagina, but not deep into the vaginal region. Whereas deep dyspareunia, of course, is pain that's felt with deep penetration vaginally. And that can be either with a toy, a finger, a penis, whatever is penetrating the area. Oftentimes, deep dyspareunia is felt deep in the vaginal tissues, even more towards the cervix, as well as some individuals will actually complain of pain in the lower abdomen, or that lower quadrant of the abdomen around the pubic bone and the groin area. So there are some different causes or contributors to deep dyspareunia, and there are some specific conditions such as endometriosis or adenomyosis. Some of you may be familiar with those terms. These are conditions that involve the uterus and the tissues around the uterus, as well as through the pelvic area. A condition called interstitial cystitis, which involves more the bladder itself, can also have individuals complain of deep dyspareunia. But if somebody also struggles with ovarian cysts or fibroids, this can present as deep penetrative pain. And of course, pelvic floor muscle tension, and that's a big one as well, which can contribute to deep dyspareunia. Okay, the other thing too is scar tissue around the abdomen after, urologic or gynecologic surgeries, C-section surgeries, or other abdominal surgeries. And sometimes people think, surgeries where there's little laparoscopic incisions, or tiny incisions through the abdomen versus a full incision in the abdomen. But either type of surgery can contribute to this type of pain. And last but not least, and I've mentioned this in some previous videos as well, stress and anxiety can also be big contributors to dyspareunia. All right, so, in a nutshell, that's what dyspareunia is. There's both superficial as well as deep dyspareunia, lots of variety of contributors to the pain. So perhaps you can think about what could be causing your dyspareunia if you are struggling with this pain. And if you have any questions, please let me know in the comments. I'd be happy to answer.